and welcome to this prostate cancer awareness session. On behalf of IHW Council, I'm Dr. Anushka Amlani, and it's my honor to welcome esteemed panelists for this session. Prostate cancer is one of the most common cancers affecting men globally. It presents unique challenges that demand innovative solutions and collaborative efforts. In this insightful virtual panel discussion hosted by the Integrated Health and Wellbeing Council in partnership with BEAR, we bring together leading experts in oncology, urology, and patient advocacy to explore the latest advancements in prostate cancer diagnosis, treatment, and care. This platform aims to shed light on emerging technologies, cutting-edge therapies, and holistic patient management strategies, fostering a dialogue on how we can collectively improve outcomes and quality of life for prostate cancer patients. Today with me, we have eminent faculties and key opinion leaders from the oncology domain of India. It's my esteemed pleasure to invite Dr. Sudhir Kumar Rawal, Medical Director and Chief of Genito Uro-Oncology Services, Rajiv Gandhi Cancer Institute and Research Center, Delhi. Welcome, sir.
Thank you.
Dr. Sandeep Goyal, Senior Consultant and Head of Medical Oncology Department, Kokila Bayan Dhirubhai Ambani Hospital, Mumbai. Thank you for joining us today, sir. Dr. Niti Raizada, Senior Director, Medical Oncology, Fortis Hospitals, Bangalore. Thank you for your time today, ma'am. Dr. Palanki Satya Dattatreya, Senior Consultant and Director, Medical Oncology, Renova Soumya Cancer Center, Hyderabad. Welcome, sir. Dr. Chandrakant MD, Senior Consultant, Medical Oncologist, Narayana Hrudayalaya, Kolkata. Thank you for being with us today, sir. And last but not the least, Ms. Urvashi Prasad, former Director, Niti Aayog, Most Influential Women in Healthcare, and 100 Most Influential Women in India, 2023. We welcome you all to this awareness talk show, and let's begin. Moving forward, to set the tone of this awareness session, my first question is to Dr. Sudhir. So how common is prostate cancer in India?
Prostate cancer incidence actually depends on the practice of screening anywhere in the country. Like in West, it is the commonest cancer, especially in America. But in India, since we do not have very strong, and we not advocate rather very strong screening program because it probably overtreats the patient. We get patients who are either diagnosed by urinary symptom or opportunistic screening or corporate health screening. Otherwise, the patient they have if they have symptom, then only they come. So, according to Globocon 2020 report, almost 35,000 cases reported per year in India. But this incidence is going up. I'm sure that it has gone up. It's just 2020 data, but in 2024, like in our hospital now, it is the fourth commonest cancer in male. What we see here, according to our data.
Thank you so much, sir, for that insightful update on statistics in India as well. Just to go back a little and understand the importance of the prostate gland, could you please explain to our audiences what is the role of prostate gland in men's health?
Yeah, actually, prostate gland is male's gland. You don't see prostate in female. The counterpart organ can say in female are breast. The cancer are same, almost ER/PR is there, but here are so many things they work together. In prostate also, they are actually seen in breast also. But it has the very important function is the production of a fluid that together with the sperm cells which comes from testicles and fluids from other glands makes the semen. It helps in making semen, and the muscles of the prostate also ensure that the semen is forcefully ejected during the intercourse. Otherwise, when we give the medicine for relaxing the prostate for patients who have benign enlargement of the prostate, the semen goes into the bladder. If we do not give the drug, the semen comes out. And it also involved in hormone metabolism, like a testosterone hormone, which is there in the body for having secondary sexual characteristics in the puberty, is testosterone, which gets converted into the dihydrotestosterone, which becomes biologically very potent and hormone for the body.
Thank you so much, sir. It was extremely important to understand this aspect and how prostate gland is important for men's overall health. Moving forward, my next question is to Dr. Raizada. Ma'am, what are the most common and early signs of prostate cancer that men should be aware of?
Thanks so much for the question. Actually, often they are very overlapping signs of prostate cancer and benign prostatic enlargement, which very commonly happen in older men. So most of them will have lower urinary tract symptoms. This could be difficulty in passing urine. It could be frequent urination. It could be incomplete urination. Sometimes there could be blood in urine and even semen. And sometimes, if it is advanced case, it can cause pelvic pain or discomfort, back pain, weight loss, and sometimes erectile dysfunction. These are normally what we have. But interestingly, as Dr. Raval also said, that we don't have a very strong, robust screening program in our country. But often nowadays, we see that patients come to health checkup or just a general screening and they do a PSA and they find it's elevated. And that's how you diagnose.
Thank you so much, ma'am. Moving on next, following up on what Dr. Raizada just mentioned, my next question is to Dr. Sindhi. So what is the role of PSA testing in detecting prostate cancer?
The prostate gland, it actually produces a specific antigen which can be measured in the blood, and that is called prostate specific antigen, or PSA. Now, any change in the prostate, such as enlargement of the prostate or infection or cancer, can cause higher levels of this antigen, PSA, which can be measured in the blood. So it is normally recommended as a screening test for those who may not exhibit any symptoms. So that's just find out whether the patient is suffering from any prostate illness or not. If the prostate PSA level is between 4 and 10 nanograms per ml, then there's a 1 in 4 chance of that person having a prostate cancer. Right? And if the level is between 10 and 20 nanograms per ml, then the chance is much higher, between 30 and 50%. So that is why it is a screening test to enable us to identify people who can be then investigated further for prostate cancer or not. And people or patients who already have been diagnosed with prostate cancer, the PSA test also helps us to identify the stage of prostate cancer and also as a monitoring tool to assess the response to the treatment.
Thank you so much, sir. And since we have have a basic understanding of the testing part, and we have reached where we have, understand the stages of the cancer, my next question is to Dr. Chandrakant. So, how does prostate cancer treatment differ based on the different stages of the disease?
Thanks for the question, and thanks for having me in this very reputed meeting. I think it was very nicely elaborated by the previous esteemed panelists. As we all know, the earlier we pick up any cancer, the better it is. So, prostate cancer is a peculiar cancer when you compare to other cancers, because not all prostate cancers require treatment. There are a good number of prostate cancers, like above 75 years, if you look into the autopsy, 1 in 4 will have a prostate cancer, and they may not become symptomatic at all. So if you look into, one is staging. Number one is we see whether it is confined to the prostate gland, whether it is into the lymph node, or whether it is a bone. So one is staging. The other one is risk stratification. So we classify the prostate cancer to a very good risk, and then some moderate risk and high risk. And if you have a very good risk, you can as well keep them under observation, and they may not require treatment throughout their lifetime. So that is one very important thing that we need to understand. Prostate cancer is one such cancer where a diagnosis does not mean treatment is required. What you call as active surveillance, just keep under follow-up and see how it grows over a period of time, is a reasonable way of treating, number one. Number two, like let's say intermediate risk or a little bit the risk factors are there, then early surgery is a way to go. And in the present day, what we call as a robotic surgery. with the least complications and less time spent, less blood loss, you can have the prostate being removed. And then a little bit locally advanced when it is spread to nearby lymph nodes. A very important thing of prostate cancer, in contrast to other cancers, is that this is hormone sensitive. You reduce the testosterone levels, the prostate just shrinks in size. So you give what is called hormonal therapy. Both tablets are there, injections are there, you give them, or you operate the testes, either of them you do. So when the hormone levels come down, the prostate gland just shrinks. After shrinking, what we do is something called radiotherapy or an IMRT. IMRT is an intensity modulator, IGRT, like just focusing the gland and giving radiation. So this is for the very early stage, and locally advanced stage. And then in those patients where it has spread beyond the prostate, let us say to the bone, lungs, and liver, this is called an advanced stage prostate cancer. So there are a lot of new things that have come up in the advanced stage, and it is no longer a death sentence. We have a lot of advanced prostate cancer patients doing reasonably well. Like hormonal therapy is what we give. Like the aim is to get the testosterone low, number one. Number two, we give some bone strengthening injections. And we do have something like targeted therapy, immunotherapy, all these. So even in advanced prostate cancer, we have plenty of options to treat to improve their lifespan. So very importantly, the key is picking up early. Be aware of the danger signs, like an elderly gentleman having urinary symptoms, back pain, weakness. The prostate cancer should come first into the patient's mind and has to approach the doctor as early. The earlier you come, the easier we can treat, the better the results you're going to get. Thank you.
Thank you so much, Dr. Chandrakant, for your detailed insight. My next question is to Dr. Sudhir. Sir, since we've had a brief discussion about the treatments available for prostate cancer and how we should deal the disease, can you discuss the potential side effects of the common prostate cancer treatments, such as surgery, radiation, and hormone therapy?
Yeah, actually any treatment of prostate cancer will have side effects, except if you are going to do the ablative therapy like HIFU. That too is focal therapy. Even HIFU has some side effects, but the focal therapy has no side effects. If you go by surgery, it's a radical prostatectomy where you remove whole of the gland with seminal vesicle and the lymph node. And the most common side effect is urinary incontinence, where the patient will have urinary leak, and these patients experience some degree of leakage or difficulty in controlling the urine. This is most of the time is temporary. 98% it recovers, and it depends on the surgeon and the technique and how much you have saved the nerves and all. Long-term side effects can be erectile dysfunction, where the patient may not be potent, especially when the nerves have been cut, and that is why these patients can have the sexual life will not be there. But this can be improved with many measures, with the drugs, with prosthesis, with other things. They can have bowel dysfunction, which is less common with the surgery, is more common with the radiation therapy. When you come to radiation therapy, it's a very common type of treatment which is given to the patients. And here, generally, it is the external beam radiation which is given, but brachytherapy is also very popular in West. Here, patient can have urinary issue, like they can have frequency, urgency, discomfort while urinating, and in some cases, radiation may lead to urinary incontinence. But when they have the urinary problem, that's a big problem for these patients. They can have erectile dysfunction like in surgery, and radiation can damage the nerve that control erection and leading to erectile dysfunction. And they can also have the loss of libido because they receive hormone. In addition, they can have bowel dysfunction, diarrhea, rectal bleeding, and discomfort during bowel movement are possible, particularly with external beam radiotherapy. Fatigue can occur to these patients especially when they are on radiation. Later on, it recovers. In hormone therapy, which is androgen deprivation therapy, where you knock off the testosterone, which actually acts for the food for this cancer, these patients can have erectile dysfunction, loss of libido. As I said, because testosterone is gone, they will have definitely loss of libido, and the small penis and erectile dysfunction. They can have hot flashes like women have during menopause. This is like artificial andropause, and this can be sometimes troublesome, and they may require the treatment also. Then there is a bone thinning osteoporosis can occur to these patients, and prolonged hormone therapy can reduce the bone density, and which can increase the risk of fracture. And that is why these patients should receive some bone strengthening treatment. They can have weight gain, which is particularly around the abdomen. Mood changes can occur as it occurs in women during the menopause. They can have emotional changes, including mood swings, irritability, and depression. These treatment side effects can vary based on the individual. Not everybody will have the like hot flashes, or even many patients who receive hormone therapy, they are sexually active. So it depends particularly on individual, but these are the most of the side effects which can occur in the patients who are on the treatment for prostate cancer.
Thank you so much, sir, for your insights and helping us understand the different side effects of these treatments. Moving on, my next question is to Dr. Neeti Raizada. Ma'am, what are the key factors that influence the choice of treatment for prostate cancer? And what are some of the latest advancements in the treatment that, and how do they've improved patient outcomes as such?
So thanks for the question. Actually, everybody illustrated about prostate cancer quite nicely. What are the key factors? First thing is, what exactly is the stage? Whether it is localized, it's loco-regional, or it is spread to other parts. If it is localized, what is the grade grouping? That's what we say. Whether patient requires active treatment right now, or the patient can benefit from only active surveillance. Now, once patient has advanced cancer, what are the things we look for? What is the overall fitness of the patient? So biologic fitness. What is the patient's age? What are the comorbidities? Because most of these are older individual and may have hypertension, diabetes, cardiac ailments. So what are the comorbidities and how well they are controlled? Whether a patient already has baseline dementia or gait disturbance or cognitive dysfunction. What is the quality of life at this juncture? And if we add a new type of treatment, what can be the change in quality of life? So the spectrum of side effects we expect and the change in quality of life that we expect. Patient preference, like if you're in a very remote area, you may not want to take injectable and you may prefer tablets. So that may also determine patient preference and likelihood for treatment success. Like if there's an easier option as tablet, I may want to give that instead of giving injectable. And of course, there are many newer therapies which can be tailor-made and changed based on patient's need. So what we focus on is personalized care or tailor-made therapy for each individual. Now, you asked me about latest advances in prostate cancer. Well, this is what is an overview of treatment. But every day there are newer things which are incorporated when we talk about prostate cancer. There is a lot of talk about theranostics. So we have a diagnostic test like a PSMA scan, which is a prostate-specific PET scan. And if there's a good uptake, we may want to do lutetium therapy or actinium therapy. So this is coming up in a big way. This could be combined with other therapies as well. We may want to do genetic profiling of tumor. So once we have genetic profiling, we may want to add either tablets or injectable, which work suitably for one type of cancer. They are more focused radiation therapy. So stereotactic whole body radiation, stereotactic body radiotherapy known as SBRT technique, which minimizes side effects and surrounding tissue damage. These are sought after. There's an emerging role of immunotherapy in such cancer patients. So in later line of therapy, we can think of newer therapies, including immunotherapy, targeted therapy, and genomic guided treatment.
Thank you so much, ma'am. Having discussed about the testing part and the importance of testing in diagnosis, my next question is to Dr. Satya. So how is prostate cancer diagnosed, and what is the impact of prostate cancer on sexual health of men?
Thank you so much for that wonderful question, because I think we have all discussed elegantly about all the previous questions posed by you. So we need to remember 5 things in the diagnosis of prostate cancer. Number 1, a thorough history. And then secondly, a thorough physical examination. We all, as a practicing oncologists, do realize that we are MBBS doctors first, then MD, MS, and then DM or MCS. So a thorough history and physical examination gives us a clinical picture about what we are dealing with in that particular patient. And then we go for some blood tests with regard to prostate cancer. The third is a blood test called as serum PSA, a prostate-specific antigen. And this gives us an idea about the presence of prostate cancer and also tells us about how much could be the level of the prostate cancer in the body. At least gives an indication of, is it less than 10, is it between 10 to 20 or more than 20, and that in a way impacts the staging also. And so forth are some investigations in staging, which can be like an ultrasound, could be a CT scan, an MRI, and sometimes a specific PET CT scan for prostate cancer called as a gallium-68 PSMA PET CT scan. So having discussed 4 features, history, physical examination, blood investigations like serum PSA, and radiology investigations, lastly, without a biopsy proof, treatment of prostate cancer is not initiated or discussed as well. And therefore, a pathology proof by doing a core biopsy, where we take multiple cores from the prostate gland or sometimes other areas which are possibly thought to be involved by the disease based on the previous scans, give a diagnosis of the type of prostate cancer and the subtype of the prostate cancer histology. Having said that, all of us also spoke about some of the treatments, and prostate cancer itself can cause sexual dysfunction. Some of the treatments for prostate cancer also may impact the sexual health. And so it's so important for all the patients to be aware that sexual health also needs to be discussed with your treating doctor and the treating oncologist. Your mind is a powerful thing. Strength is not just in the body, it's in the mind. And please remember, real men talk about their feelings too. A healthy mind is a wealthy soul. And so your mental health and sexual health too is a priority. How do we improvise these sexual dysfunctions because of the disease or the treatment sometime? Well, a healthy, hygienic, balanced diet, regular exercises, being physically active, especially pelvic floor exercises, all of this go a long way in improving the sexual dysfunction, which can be either because of disease or sometimes because of treatment. So again, I would like to end by telling that mental health and sexual health too is a priority and can go a long way in improving the outcomes of our patients of prostate cancer in this country. Thank you so much.
Thank you so much, Dr. Satya, for highlighting the importance of mental health as well for better patient outcomes. My next question is to Ms. Urvashi. Ma'am, kindly take the question to help the audiences understand how does the current national healthcare policy address the prostate cancer awareness and early detection, particularly in the undeserved areas where the rural populations reside?
Yeah, thank you for having me here. So I think screening, it is a big issue right now. As everybody would know, we don't really have a systematic way to undertake screening. And when I mean screening, it doesn't necessarily mean, even doing the PSA tests or, whatever it might be, but also just having basic awareness of the prostate cancer symptoms, especially the kind of symptoms that somebody might get early on at the primary healthcare level. That is very important, because even if you are not able to systematically screen or do a large-scale test for everyone, if our primary health workforce can at least be aware and create awareness in turn amongst the rural population about these symptoms, about this illness, then I think a lot of the cases, would actually get picked up much earlier. Because like with other cancers, many other cancers in India, even prostate cancer, we tend to pick up at the later stages. when the disease is more advanced, it's naturally more difficult, more complicated to treat. And also the other thing about the Indian demographic is that, again, like many other cancers, even prostate cancer also happens in men who might not necessarily be in their 70s or 80s. It might be in younger men, they might be in 50s, 60s, or even younger, as I think more and more doctors are now reporting their own experiences as well of this. So I think if we have to pick up such cases early, if we have to give such people quality of life, alongside, of course, quantity of life, then I think this awareness, this basic awareness at the rural level, the primary health level amongst our primary health workers is very, very important.
Thank you so much, ma'am, for highlighting the kind of awareness that our system lacks, and we need to work in that direction. Thank you so much. My next question is to Dr. Sudhir Rawal. So, would you like to share your message on the occasion of Prostate Cancer Awareness Month to our audiences, irrespective of the ages, for their health?
Yeah, I think not only prostate cancer, but in general, one should take care of his health. But prostate cancer is one cancer which, if detected early, you get cured. You will have less side effects when you are detected early of the treatment, which can cause a lot of quality of life issue, especially in younger patients. As this cancer can occur in young patient also, especially when they have family history. So they should be having especially if your father or brother is having cancer, they should have their PSA done after 50. We do not advocate PSA routinely unless the one has symptom of urinary symptom only, then they should have PSA. But if you have family history, it is better to have PSA at 50. And always consult a doctor if you have urinary symptom like lower urinary tract symptom, the slowing hesitancy, like slowing of urine, urgency, urgent incontinence, like you have to rush to the bathroom, or you have blood in urine. And I hope nobody delays themselves that they develop backache. I still remember when I joined this hospital in 1996. I used to have 95% of the patient who will come with the backache, they have metastatic disease. Right now in our center, almost more than 45% of the patient, they come with the early disease or locally advanced disease. Still 55 to 60% of the patient, they are coming in the advanced disease, metastatic disease. So still there is a lot of scope, lot of things to need to improve upon. So any patients who have any urinary symptom, he should have his PSA done and consult his doctor.
Thank you so much, sir, for your valuable insights and helping our audiences prioritize their health and take early steps in detection. Thank you so much, sir.
Thank you.
My next question is to Dr. Sandeep Goel. Sir, you've understood the importance of testing and early diagnosis and also the lack of awareness. Having discussed that, what role does genetic testing play in management of prostate cancer? And also, how can lifestyle changes lower the risk of developing prostate cancer in men?
So, genetic testing can help doctors learn more about the patient's particular cancer as well and develop their treatment plans. So there are two types of genetic testing. One is your germline testing, which is done on the blood sample. And one is your biomarker testing, which is done on the tissue, on the biopsy sample. So the biomarker testing will help us, plan the treatment for the patient. If the patient has got certain molecular targets which are seen on the biopsy, then accordingly the treatments can be planned, the target therapies can be given, immunotherapies can be given, and different chemotherapy regimens can be sorted out. The more important is your germline testing, for example, to know whether the patient's genetic problem is there, which has led to development of prostate cancer, especially in younger patients, patients less than 50 years of age. And that can be help us to identify the patients themselves and their family members as well. to also, there are drugs now, like there's something called BRCA1, BRCA2 mutations. So these mutations, if are found in that particular patient, then we have drugs now specifically targeting these mutations like PARP inhibitors, and they work quite well in these patients. So genetic testing, two ways. One is germline. Second is your biomarker testing on the tissue sample. And again, it helps in identifying patients, their family members at risk, counseling them, trying to screen the relatives at an early age if their genetic testing comes positive, and also helping in the treatment decision making.
Thank you so much, sir, for your insights. Would you like to add about the lifestyle changes?
The lifestyle changes, yes. So basically, there's no short way to prevent prostate cancer developing, but there are definitely some things which you can do to reduce the risk. Now, first of all, you have to identify which are the high risk patients. So especially patients who've got a family history of breast cancer or prostate cancer, or patients who are overweight, who are not following a healthy lifestyle. Increasing age, with advancing age, more than 50 years, the chance of prostate cancer, getting is higher. So there are some modifiable risk factors and the non-modifiable risk factors. So non-modifiable risk factors are like age. Now, you can't do anything about age. Everybody, you can't do anything about it. But yes, if you maintain a healthy weight, reduce the chance of getting obesity, right? Do regular exercise, eat a healthy diet, especially diet containing something called lycopenes, like tomatoes and all. So these are all antioxidants. They can help reduce the chance of developing prostate cancer. Enough exercise is very important, not just for prostate cancer, for all cancers as well. Reducing alcohol consumption, increasing of vitamin D intake, taking certain supplements like vitamin E, selenium, all these, although not definitely proven, but yes, to some extent, they help reduce the chance of getting prostate cancer. And especially the screening is important. So especially for patients who have got a family history of prostate or breast cancer.
Thank you so much, Dr. Sandeep, for your insights. My next question is to Dr. Chandrakant. So like Dr. Sandeep had mentioned about the importance of screening and genetic testing, my question to you is, how often should men undergo screening for prostate cancer as such, and what age exactly should they start getting the screening done?
So, well, I think that's a very relevant question to the large public who do not have prostate cancer yet. So the very word screening means trying to find out cancer in an asymptomatic patient. Patient has no symptoms. Like so many of us over here, we have no symptoms of cancer. Is there a cancer that is there in me? To trying to find out a cancer that is asymptomatic is called screening. Okay. So what is the test we do for screening? One blood test, that is PSA, prostate specific antigen, right? So whom should we do? We should do, I'll just give you the values and then I will explain regarding that. Above 50 years, once in 2 years, till 70 years, one blood test is sufficient. In those patients who are at very high risk, like a family history of cancer, let's say breast, ovary, prostate, pancreas, all these, if there is a family history in first age relatives, then as early as 40 years, you can start PSA screening. There was something like digital rectal examination. Nowadays, that is not required. Just a simple PSA blood test is sufficient. A PSA blood test above 10, normal value is less than 4, roughly. About 10 is when the suspicion is very high. Then you have to approach the urologist or a doctor and look what is happening. 4 to 10 is not clear what it is. We may have to repeat and see whether it is increasing or reducing. More importantly, PSA high doesn't mean cancer. It can be high due to infection also. So PSA is of course important, but that is not a diagnostic test for cancer, right? So should we screen everyone now in the nation or in the world for this above 50 years, once in 2 years or once a year with PSA? The answer is no. Why is it no? Well, there are some disadvantages of screening. What are the disadvantages? One is a PSA can be high and still need not be cancer. So a person may undergo extra investigations. Like, let's say a patient had a PSA of 12, then there is an alarm. Is it cancer? Then he has to undergo an MRI. And then he may have to undergo a biopsy, right? Extra tests, extra burden in the patient, and mental anxiety in the patient. And finally, the result may turn out negative. And very importantly, even though a prostate cancer is found in this patient may not require treatment throughout his lifespan. So these are the things. So a prostate cancer diagnosed doesn't mean you have to treat it. You are picking up a disease that is silent and saying, I picked up the disease and I'm diagnosing. And very importantly, none of the screening programs have shown improvement in mortality. You're diagnosing more cancers. That doesn't mean you're saving more lives, right? So what we call as the PSAs, the prostate cancer screening should not be universal. It should be an opportunistic, or it should be a screening based on mutual discussion with the patient. It's based on a proper discussion with the patient. Even the patient should also understand the pros and cons of it. He should understand a high PSA doesn't mean I have cancer. I may have to undergo extra investigations which may not result in improving my lifespan. All these nuances are there. Therefore, prostate cancer is not a standard screening in our country up to now because of these nuances, right? So if you have a family history, I agree, there it matters because you're at a significantly high risk, like 30%, 40%, 50% risk, and at times BRCA2 mutation, you have very significant risk. There it matters. Yeah, you have to do some important screening. So screening is important, can be done in all, but only after mutual discussion with the, not with the, I mean, he's not a patient, he's a normal individual. Only then you will do screening, not a blanket screening for everyone. Thank you.
Thank you so much, Dr. Chandrakant, for your interesting insights. I'll come back to you. Meanwhile, my next question is to Dr. Sandeep. So can I please have your message for our audiences for this occasion of Prostate Cancer Awareness Month?
I think the message is very simple and clear, that one need not worry about prostate cancer to a great extent. And the reason for why I'm saying that is that, first of all, it can be prevented if we follow a healthy lifestyle, exercise, and whatever I mentioned earlier, doing all those things. And secondly, even if it happens, then we've got very good options of treatment now. It can be picked up at an early stage. There are options of surgical, radiation, chemotherapy, immunotherapy. A lot of options are there. And the patients can maintain a good quality of life for a prolonged period. Some patients, as mentioned, may not need any treatment at all. And they can, continue to lead a normal routine life along with the cancer. And even if they have to undergo treatment, the treatment options are many and they are quite well tolerated and with a good quality of life.
Thank you so much, Dr. Sandeep. It was really nice to have you with us today. Thank you, sir.
Thank you very much.
My next question is to Dr. Satya. Sir, how does prostate cancer affect the quality of life? And what support is available to help manage these impacts?
It's so important that we focus on the quality of life of cancer patients, either because of diagnosis or because of the treatment. Prostate cancer and its treatment too can affect the quality of life. And you could have two measures. One is general, which means that, like, say, is the patient having fatigue or malaise or asthenia? What was vitality? How active he is? It could be also with regard to the performance in physical roles and how his life has got impacted socially, so that now he would not want to mix with many of his friends or the society. So one is general, how the quality of life is. The second is specifically to the prostate cancer. Say, for example, urinary health, sexual health, and also bowel function. So both the disease-related quality of life, disease-specific, and general quality of life, both have to be addressed when we treat our patients of prostate cancer. It makes a lot of sense to spend time with the patient, listening to him, so that he comes out with how he is getting impacted, either because of the disease diagnosis or because of disease treatment, and how the disease itself is somehow hampering the quality of life. And then when we understand those issues and problems, it becomes a lot more easy to address them much more effectively. A healthy, active lifestyle, group education, various support interventions are now available for all such patients across all such cancers. And these are becoming increasingly popular even among men with prostate cancer. Say, for example, I would say sitting is the new smoking. And that's why having a healthy, active lifestyle, avoiding sedentary lifestyle, focusing on healthy food habits, eating lots of green vegetables, colored fruits, like tomatoes, carrots, beetroots, all of them contain good and powerful antioxidants, which go a long way in helping not only against the disease, but also tackling all these quality of life adverse events which can happen either because of the disease per se or because of the treatment.
Thank you so much, Dr. Satya, for your insights. Moving on, my next question and last one for this session is to Ms. Urvashi. Ma'am, are there any ongoing initiatives by the government for integrating prostate cancer education into a broader public health campaign? And how can we measure the effectiveness of such initiatives planned by the government?
Yeah, so I mean, in terms of cancer, like I said, that one big push has to be obviously at the prevention and early detection levels. And I think for that, we need to really strengthen our public health system, nutrition, awareness, of course, amongst people, because, knowledge is power in these kind of, illnesses. And of course, the primary health system, as I said. So, we have these health and wellness centers being set up under Ayushman Bharat, but the problem is that a lot of them are not fully operational, and we're not, yet rolling out the full package of services which are supposed to be provided eventually. So we need to really make these health and wellness centers functional. We need to make sure that the health workers, the health professionals at our primary care level are at least aware of, what the symptoms are, to educate people about these things. Because I think for the vast majority of our population, even that very basic thing is still lacking. I'm not talking about the urban areas, the big cities, or even the smaller cities, but I'm talking about most of our rural, remote areas, even some of our smaller towns where, people don't have access even today to some of the very, very basics. So I think that is something that I would actually hope that the government will do. And will do more of, because I think there's a lot that we need to do, not just for prostate cancer, but obviously other cancers as well. And I think the other thing that at least, I've been pushing for in whatever policy advocacy, etc., that I've done, is to say that, again, things like the advanced treatments that we have for, prostate cancer, or the gene testing, the BRCA mutations, which often occur in people who develop these ailments. That's not something that is easily affordable and accessible for everyone, and that is still a very small minority in our country who can access advanced treatments and actually pay for them. So I think the government has to step in and play a much bigger role in all these areas, because we're still not a country, which has that level of affordability and that level of accessibility. So I think that clearly has to be a public health system push. Obviously, we have to work with the private sector, but I think a lot of the heavy lifting on that front has to be done by the public health system.
Thank you so much, ma'am, for those insights and highlighting the importance of the primary healthcare system and the awareness and the role these things play in advocating for such awareness campaigns. As we come to the end of this amazing session, I would like to thank all panelists. But before we conclude, I request Dr. Satya, Dr. Chandrakant, and Ms. Urvashi to kindly share their message for the Prostate Cancer Awareness Month.
Shall I?
Yes, sir. Dr. Satya, you can go first.
So thank you so much. And I believe that healthcare is a right. It's not a privilege. And that's why we all are for the past 30, 40 minutes deliberating on to inform you all that we are here with you in this fight against cancer. You are not alone in this crusade to cancel cancer or this battle to beat cancer. Together we can and we will. A lot has been done. A lot still needs to be done. Having said that, I think it's important for all the men out there to understand in this September, the Prostate Cancer Awareness Month, that it's okay not to be okay. Being strong also means seeking help when needed. So please reach out to your partner, to your friends, to your doctors, to your families, if you have any health issues, because especially with regard to cancer, it's curable if diagnosed early and treated appropriately. And also, as we all discuss about the PSA screening being an important way to identify it at a very early stage. And of course, we all understand that prevention is better than cure. So focus on an active, healthy lifestyle. Thank you so much.
Thank you, Dr. Satya, for your insights. Dr. Chandrakant?
So, well, I think we had a very fruitful discussion. I think I'm impressed with the way Ma'am Urvashi looked into, like, we always, the government schemes always lag behind with the old systems. But now, she's able to catch up with the new systems of genetic testing, new modalities of treatment. This is very important. Getting new treatments to a national health scheme is something really phenomenal. And this doesn't happen in a country like India. We haven't seen, and we are seeing it right now. The new systems are recognized as important modalities of improving lives. So that is very important. So very healthy initiative, number one. And number two, everyone should be aware of the danger signs of prostate cancer. Right from 50 years or 40 years, if you have family history, urinary problem, back pain, you must think of prostate cancer. If it is persisting over a period of 4 to 6 weeks, so you must consult your doctor. Never ignore urinary symptoms. That's what I want to know. Thank you.
Thank you so much, Dr. Chandrakant. Urvashi ma'am, can you please have your message?
Yeah, I mean, of course, I'll add, concur with, my other panelists in terms of, knowledge, like I said, is power, and you can do a lot if you are educated, informed about, the illness and its signs and symptoms and so on. And then, as I said, I really hope that our governments will, do and step up where they need to, because I think it's, at the end of the day, it's not just a statistics game. Every life matters. Every life is not just a number. And, I can say it because I lost my dad to this ailment. And I know that, he was not just a statistic. So, and in his case, interestingly, he had that BRCA mutation, but that was not tested, even for the longest time. So I think we have a long way to go. I'm always happy to share the optimism of, advances we've made, etc. But I would like to say that, in this case, we need to focus more on what needs to be achieved, because losing even one life, matters to that person and obviously to their family. So I don't like to just throw around numbers, statistics. At the end of it, everyone is a human being. So I think we all need to really push in that direction, and especially the government, like I said, because we are still a country that lacks a lot of affordability and accessibility. So I hope that, if even speaking on a forum like this, trying to get the message out will make even a little bit of a difference, then that will be a wonderful outcome. Thank you.
Thank you so much, ma'am. It's my privilege to share this forum with such esteemed and passionate individuals in both the field of medicine and public healthcare advocacy to bring a change. On this note, I would like to conclude this panel discussion, and I look forward to meeting all of you in person. Thank you.